Once you reach your 60s, every choice you make around food carries more weight than ever before. Each bite, each habit, and even the foods you've long considered healthy, can directly influence the strength of your heart. And here's the surprising truth: some of the vegetables you eat every day may actually be working against you. As a cardiologist, I've witnessed this countless times. Patients in their 60s and beyond come into my office confident they're doing everything right, loading their plates with leafy greens, cutting back on sugar, and steering clear of fried foods. Yet many are shocked to learn that certain vegetables, depending on how they're prepared or how they interact with their medications, can slowly put their heart at risk. Some vegetables can drive up blood pressure, others interfere with critical medications, and a few may even harbor bacteria that an older immune system struggles to fight off. The danger is not always obvious, and that's exactly what makes it so concerning. What seems like a smart, healthy choice could, in reality, be quietly undermining your heart health. I want to share an important warning with seniors everywhere. Some vegetables you've always believed were healthy may actually be putting your heart at risk. In this chapter, I'll reveal 5 specific vegetables you should either stop eating, or at the very least, prepare differently. I'll explain exactly why they can be dangerous and give you safer, heart-friendly alternatives you can enjoy without worry. The good news is these risks are not permanent or unavoidable. Once you understand which foods to be cautious with and how to adjust your meals, you can protect your heart and still maintain a balanced, enjoyable diet. And here's the part that may surprise you: the very first vegetable on this list is probably sitting in your refrigerator right now. Spinach has long been celebrated as a superfood, packed with nutrients and often considered a symbol of healthy eating. For many people, it truly is a beneficial choice. But for adults over 60, especially those who rely on heart medications, spinach can quietly turn into a serious health risk. In my years as a heart specialist, I've seen this more often than most would believe. Patients proudly tell me they're eating clean, filling their plates with leafy greens, and avoiding processed foods. Yet, despite their best intentions, they sometimes discover that their diet is undermining the very medications keeping them alive. The reason lies in spinach's high content of vitamin K, a nutrient essential for blood clotting. On its own, that's a good thing. But for anyone taking blood thinners such as warfarin, commonly prescribed after a heart attack, stroke, or for atrial fibrillation, excess vitamin K can reverse the medication's protective effects. Instead of thinning the blood, the drug becomes less effective, leaving patients vulnerable to dangerous clots. The most concerning part? Many seniors have no idea this interaction is even happening. They believe they're protecting their heart when, in reality, the very food they trust may be working against their treatment. You may feel perfectly fine and believe your medication is doing its job. But beneath the surface, your body could be quietly losing its protection against a life-threatening blood clot. I've treated patients who suffered strokes and dangerous clotting events simply because they added spinach smoothies or oversized salads to their daily routine, without realizing how dramatically it could affect their treatment. Spinach itself isn't the enemy. The real danger lies in inconsistency. If you eat it, do so with moderation and, most importantly, consistency. And always let your doctor know if you're making dietary changes, no matter how harmless they may seem. What you eat has the power to support your medication or completely undermine it. The truth is, not every vegetable is automatically heart healthy for every senior. Some can actually cause more harm than a plate of fries if you're not paying attention. If spinach, one of the most celebrated greens, can weaken a life-saving prescription, what other everyday vegetables might be hiding silent dangers in your bloodstream? The next hidden risk may already be in your refrigerator, a food many enjoy as a crisp, tangy snack or the perfect side to a sandwich: pickled cucumbers. Pickles may feel refreshing and harmless, but for seniors over 60, particularly those with high blood pressure or a history of heart disease, they can pose a serious threat. What most people don't realize is that pickles are packed in brine loaded with sodium. In fact, a single serving can contain more than 1,000 milligrams of salt. That's nearly 2/3 of the daily recommended limit for older adults. And all it takes is just a few slices. Sodium isn't just about flavor. it changes the way your body works. Too much salt traps excess water in your bloodstream, increases your blood volume, and puts significant strain on your heart and blood vessels. Over time, this added pressure can lead to chronic hypertension, stiffening of the arteries, and eventually, heart failure. What seems like a simple side dish could be quietly tightening its grip on your cardiovascular health. I've seen patients walk into my office frustrated and confused. They had done everything right, cutting out fried foods, exercising regularly, even giving up alcohol, yet their blood pressure refused to come down. The culprit, in many cases, was something they never suspected: the small pile of pickles sitting on their plates. The danger of salt is that it works silently. There are no obvious warning signs until it's too late, until a stroke strikes, chest pain appears, or a diagnosis of congestive heart failure is delivered. For adults over 60, the risk is even greater. The kidneys don't filter sodium as efficiently as they once did, and the arteries are more vulnerable to the damage it causes. Pickles, canned vegetables, and even seemingly healthy soups can be loaded with hidden sodium, undoing months of hard work and maintaining a heart-healthy lifestyle. The solution is not to give up flavor but to choose it wisely. Cooking at home, reading nutrition labels carefully, and seasoning food with herbs, spices, or lemon instead of salt can protect your heart more than you might imagine. Salt isn't the only hidden danger lurking in your kitchen. Another culprit looks harmless at first glance but can quietly spark inflammation and elevate blood pressure with every bite: red chili peppers. For many people, food is more than fuel, it's culture, tradition, and comfort. A dash of chili pepper in a stew, a sprinkle over a meal, or the familiar kick of spice can feel like a celebration of flavor. But for seniors over 60, that fiery sensation may be setting off something far more serious inside the body. Red chili peppers, particularly the hotter, more concentrated varieties, stimulate the nervous system, raise adrenaline, and accelerate the heart rate. While younger individuals may tolerate these effects without issue, aging arteries and a more sensitive heart make this stimulation increasingly dangerous. What once added excitement to a meal can, over time, ignite a slow-burning fuse within the cardiovascular system. I've had older patients arrive at my clinic complaining of heart palpitations, chest tightness, or sudden spikes in blood pressure, often after a spicy meal. Most are shocked to learn that the real culprit wasn't stress or exertion, but the peppers on their plate. The danger goes far beyond the burning heat on your tongue. Spicy foods trigger the body's stress response, causing blood vessels to constrict and blood pressure to surge. For someone already living with heart disease or hypertension, even a single fiery meal can push the heart into an irregular rhythm, or in severe cases, trigger a heart attack. When consumed regularly, hot chili peppers can also fuel chronic inflammation throughout the vascular system, gradually damaging the very pathways your heart depends on. Over time, that repeated irritation weakens the body's ability to protect itself, increasing the risk of long-term cardiovascular problems. This doesn't mean you have to give up flavor. There are countless ways to make food delicious without fire. Mild herbs, garlic, ginger, and citrus can brighten a meal without overtaxing your heart. Pay attention to how your body reacts. Comfort food should never come at the cost of cardiac stress. If spicy foods can quietly strain your heart, consider what happens when a food long celebrated as medicine begins working against you. Garlic has been praised for centuries as a natural healer, known to lower cholesterol, thin the blood, and support heart health. Many seniors trust it so deeply that they chew raw cloves or even swallow them whole, convinced they're protecting themselves. But as with any powerful remedy, misuse can turn it into a hidden danger. Raw garlic is an extremely potent blood thinner. On its own, that might seem beneficial, but when combined with common heart medications, particularly anticoagulants such as warfarin or aspirin, it can dangerously amplify their effects. Instead of preventing clots, the blood can become too thin, raising the risk of internal bleeding, severe bruising, or even life-threatening hemorrhages. I've treated patients who experienced persistent nosebleeds, passed black stools, or suffered sudden drops in blood pressure, all while believing they were strengthening their hearts with raw garlic. The lesson is clear: even natural remedies must be used with caution, especially when combined with prescription medications. The risks of garlic don't stop at bleeding. In large raw quantities, it can cause blood pressure to drop abruptly. For someone already on medication for hypertension, this sudden dip can lead to dizziness, fatigue, or even fainting. And when the heart doesn't receive enough blood flow, that's when serious damage begins. What makes this so frustrating is that it feels like you're doing everything right. You're not eating junk food, you're not being careless, you're relying on a natural remedy that's been praised for generations. But the truth is, even natural foods have limits. After age 60, your body changes the way it responds to both food and medication. The smartest health choices aren't based on tradition alone, but on understanding how your body works now. If you enjoy garlic, the safer choice is to use it cooked and in moderation. And always speak with your doctor before making it part of your daily routine. But if raw garlic can pose such silent risks, what about something even more common? Something that looks fresh, crunchy, and full of life, yet may be hiding a serious threat? Raw sprouts may seem like the perfect addition to a salad or sandwich, but beneath that innocent crunch could be a danger your heart can't afford to face. Raw sprouts like alfalfa, bean, or mung are often praised as superfoods for their enzymes, crisp texture, and living energy. But the very conditions that make them grow, warmth and moisture, are also perfect breeding grounds for bacteria such as E. coli, Salmonella, and Listeria. While younger adults may bounce back from foodborne illness, seniors face much greater risks. A weakened immune system means the body fights infections more slowly and less effectively. What begins as mild stomach discomfort can quickly spiral into sepsis, severe dehydration, or even a dangerous infection of the heart lining, a condition known as endocarditis. In my years treating older patients with heart conditions, I've seen firsthand how something as small as a contaminated sprout can lead to hospitalization, irregular heart rhythms, or worsening congestive heart failure. When the body is overwhelmed fighting off infection, it can't focus on healing the heart, and by the time symptoms are recognized, the damage is often already severe. The irony is devastating. You try to eat fresh, green, and clean, only to be harmed by the very foods you believed would nourish you. That's why raw sprouts should never be taken lightly. If you choose to enjoy them, make sure they're cooked first. A quick sauté or gentle steam is enough to destroy harmful bacteria while still preserving much of their flavor and crunch. Your heart deserves protection, not unnecessary risk, and sometimes the safest choice is the simplest one. When it comes to protecting your heart, the answer isn't only in what you eat, it's also in how you eat it, and how your body is able to handle food now, not 20 years ago. Aging changes the way your system responds to nutrients, medications, and even the most familiar ingredients. A sprout may look harmless but can harbor dangerous bacteria. And other vegetables, while perfectly healthy on their own, may become risky when combined with certain heart medications. Some of them may already be on your dinner plate tonight. That raises an important question: what should seniors eat to truly protect and strengthen their hearts? After learning which foods may quietly sabotage your health, it's natural to wonder what belongs in your kitchen, and what can safely help your heart heal, grow stronger, and thrive well beyond 60. The answer doesn't come from trendy diets or miracle ingredients. It lies in real, whole foods that nourish the heart and work in harmony with your body's changing needs. These are vegetables that ease inflammation, help balance blood pressure, strengthen blood vessels, and most importantly, complement your medications instead of interfering with them. Steamed broccoli, gently roasted carrots, sautéed kale, sweet potatoes, cooked tomatoes, and heart-friendly legumes like lentils and beans are excellent examples. They're packed with antioxidants, potassium, fiber, and plant-based compounds that actively protect your arteries and reduce strain on the heart. Unlike raw sprouts or salty pickles, these foods are kind to your digestive system, support stable blood sugar, and help keep blood pressure in check. These are the vegetables that not only nourish you, but also give your heart the tools it needs to keep beating strong. After 60, your heart rarely needs extremes. It benefits most from steady, sensible choices repeated every day. I've watched patients rebuild cardiovascular strength not through fad diets or drastic measures, but by assembling simple, nourishing plates: a cup of lightly steamed greens, a roasted root vegetable, a warm bowl of bean soup. Those small, consistent swaps, made day after day, can begin to reverse years of silent strain. Flavor doesn't have to be sacrificed. Fresh herbs like rosemary and parsley, a sprinkle of turmeric, a touch of garlic used in moderation, and a squeeze of lemon brighten meals without adding stress to the heart. Food should feed your body and lift your spirit. There is, however, one more step you must take to protect your progress, an everyday habit that can negate even the best dietary choices. And we'll address that next so you can fully safeguard the work you're doing for your heart. Your heart has been working for you since the day you were born, beating more than 2 billion times by the time you reach your 60s, and now it's asking for your attention. Aging isn't a call to give up, it's an invitation to be wiser. What served you in earlier decades may not serve you now, and some vegetables eaten the wrong way, at the wrong time, or alongside certain medications can quietly do harm. The good news is that change is powerful at any age. Small, sustainable adjustments, eating consistent, cooked vegetables that pair safely with your medications, staying active in ways that fit your body, prioritizing sleep, and keeping open communication with your healthcare team, can begin to repair years of wear. I've seen seniors go from breathless and tired to stronger, clearer, and more energetic simply by paying close attention and making modest, lasting changes. Your next heartbeat is a gift you can protect. Reflect on one small change you'll try this week, and if this message helped, share it in the comments or like and subscribe for more practical guidance. Always check with your doctor before changing your diet or medications. Your care team is your partner in keeping your heart healthy.